coming to the procedure now. We have learned now till now what are the pre-procedural considerations. We are taking consent from the patient. We are choosing the vein properly. Now is the steps proper. So hand washing, this is the first and the most important step. Hand washing should always be done in case of any medical procedure, and same goes also for IV cannulation. So we assemble the equipments which I had already shown. All the equipment should be ready in the tray provided. Remove the cannula from the packaging and check if parts are operational. This is very important. Before inserting the cannula, we need to check that all the parts are functioning properly or not. Then loosen the white cap and gently replace it. Then we apply the tourniquet and identify the vein. As you can see, the tourniquet is being applied and the vein is identified. Now clean the area over the vein with alcohol soaked cotton and allow it to dry. So if we are not able to proceed or not confident that the vein which we have identified and palpated can be peripherally cannulated and we can insert the cannula, we remove the tourniquet, put on non-sterile gloves and reapply the tourniquet a few centimeters above the site. This is very important. Now remove the protective sleeves from the needle, taking care not to touch it. This is to be done to avoid contamination. You should not touch it. Now hold the cannula in your dominant hand, stretch the skin over the vein to anchor the vein with your non-dominant hand and do not repalpate the vein. This is very important. We have palpated the vein already before we are determining that we will insert the peripheral venous cannula there, and we should not repalpate the vein once we have stretched the skin to insert the cannula. So what angle should we insert the peripheral venous cannula? The angle should be 10 to 30 degrees to the skin, but of course this will depend on the skin vein depth, and so in general it is 10 to 30 degrees to the skin. And we observe for blood in the flashback finger. So as we can see, this angle is very important. We have to insert, as we have said, 10 to 30 degrees, some say 15 to 45 degrees angle. Using your non-dominant hand should be used to keep the skin taut. So now lower the cannula slightly to ensure that it enters the lumen and does not puncture the external wall of the vessel. Then, as we can see, the next step is to gradually advance the cannula over the needle while withdrawing the guide to note a secondary flashback along the cannula. This is to ensure that the peripheral venous cannula which we are inserting has entered the blood vessel. Then the next step is to release the tourniquet. The tourniquet must be released once the cannula has entered into the vein. Now apply gentle pressure over the vein beyond the cannula tip and remove the white cap from the needle. We have to remove the cap and dispose it in a waste sharp container. This biomedical waste management should always be kept in mind because it is a waste sharp and has to be disposed accordingly. Now attach the white lock cap and secure the cannula with a dressing. So this is the complete steps of the procedure, and I am grateful to Mr. Gurabam Osman for providing these pictures of the steps one by one. Now last step is to flush the cannula with NS or attach the IV set with fluid to see if the IV cannula which we have done is adequately functioning or not. So this I had already explained. So you can see the video here. The steps of the cannula. See, first we are gently tapping and stoking. As we can see, we are tapping and stoking on the vein. You see, the veins have engorged. As we can see, the veins have engorged. Now the cannula is being inserted at an angle of less than 30 degrees to the skin, and then slowly withdrawing the needle while gently introducing the cannula and see for the blood in the flashback. As you can see, the blood is coming in the chamber, and once it is done, then we have to secure the cannula. After the procedure is completed, now there are some important post-procedural considerations which should always be kept in mind. This should never be missed. An IV cannula, securing an IV cannula with a dressing and completing it and disposing the parts used, including the needle, into the waste shaft doesn't end the procedure. We have to document the procedure. This is very important. Date and time of inserting the peripheral cannula, the site and size of cannula, where and what size we have inserted, that is to be mentioned, and any difficulties which is encountered during the procedure is also to be kept in the note, because it will help other medical personnel, so when they are cannulating the same patient, to avoid, like if in some particular part of the veins of the body there are many valves and we are having difficulty, this should be noted. Also, if it is multiple prick sites should also be noted, so that this site should be avoided in the first go. And of course, we have to thank the patient after the procedure, clean the area as I had already shown, and ensure that all wastes are disposed properly as per the biomedical waste management protocol.